Thanks. Thank you all for coming today. One of the things I'd first like to do is actually thank our customers for their patience. That's one of the things that Boil Water Advisory is never pleasant. It's one of those things. I'd also especially like to thank those customers that have come into the office and offered encouragement to our staff who called in and done that. And especially those customers who actually stepped up to the plate and actually taken a leadership role in the community, like Gord Hammond with the White Rock Ratepayers Association, who distributed information to his community and has stopped by the office. Our staff, as you can imagine, are distraught over this and have been working since Friday extensively to try to clean the system out, flush it, and identify the source. We've had a number of people in support of us. Your Whiteside and crew at Lytle, our engineer, has been working steadily with us. And Precision Drilling, you've probably seen him out at the site doing lots of work for us. Fraser Health, we have been coordinating this effort with them since last Thursday. They have been a great source of strength for us inside the water utility, as has been the City of White Rock, who has offered all kinds of support to us with respect to this incident. What I'd like to do now is go through briefly the sequence of events, what happened. We have our regular monthly sampling that we do throughout the City of White Rock. Those things are done weekly at various different spots. So over the month we cover all different sites. On Thursday the 19th, we received a sample back with one sample out of the ones that were taken at that time that has positive E-coli coliforms, and that was a significant issue for us at that point in time. We referred then back to Fraser Health and any drinking water quality guidelines for the process that we've got to address that in our emergency response plan on what we need to do in consultation with Fraser Health. Because it was one site with a low number, the procedure and protocol for that is to resample, and that was done immediately on the 19th. The results were received back on the 20th. The issue that you've got on this is that it's a 24-hour test. The material has to grow in a medium, and then you count them at that point in time. So that's why it takes 24 hours to get the results back. So late Friday, at that time, we had 2 samples with 1 count each at the same sampling site. At that time, we also liaised with the City of White Rock as well as Fraser Health, and a boil water decision was issued at 10:30 Friday evening. At that time, our emergency response plan kicked in. As you can imagine, we operate a large number of utilities and have been doing so for 107 years. Our emergency response plan contains a section on boil water advisories for just this sort of eventuality, and that kicked in at that point in time. People were notified. There's a notification procedure section in there. We identified who needs to be notified when, and then we continued on with that. What we did at that point in time is started a source to tap investigation. So basically, because we had 2 samples in the middle of the system, we did not know where the actual material was coming from, where the intrusion was. So we looked at right at the source, at the wellhead. All the sample data had been recovered from the wellhead. There was nothing there to indicate that. We went to the reservoirs, external examinations. Nothing was found there at that point in time. We looked at whether the lab results were good or whether they were bad, and it turns out we used 2 different labs on that, so the results were clearly good. Our sampling, we were able to sampling error, and basically we had 2 different people taking the samples, so our procedures were good. We also looked to see if there was any construction in the immediate area to identify perhaps it was a cross connection or a broken pipe or something along those lines that would permit an intrusion. That did not occur. We also looked at our hydraulic model and said, okay, we have the water here at this point in time that has 2 positives. What are we going to do about this, and where is the water coming from? So the hydraulic model clearly indicated that the water was coming from well number 6, which is located at the Merklin Reservoir site at that point in time. So once we determined that, we started flushing from that point outwards to push any contaminated water through the system. Over the next 2 days, the extensive sampling that we had, basically at least 24 sites were done each day. All of the results came back negatively. We did not have any indication that there was any other contamination other than that sample site. That sample site is a standpipe, and if you think about your hose bib at home that you connect your garden hose to, basically that's where the sample was taken. One of our investigations looking at that site saying, how hard is that to clean and disinfect before you take your sample? Was that the source of the contamination? At that time, it was the leading contender for the cause because we had no other data. The 2 days of zero results really didn't help us identify where it was coming from, and in fact, was counterproductive to our efforts. We continued on with what we were doing, but it certainly wasn't helpful to identify where the source was. Following that, we received results on Monday, once again with our extensive sampling throughout the entire system, starting right at the wellheads and working through the system, that we had 3 positive samples. One of the positive samples was located at the Merkland Reservoir, and that had 2 counts of E-coli coliforms in it, and 2 other sites, one east at the Sarge Hospital, in there, that had 1 count, and 1 directly south of the Merkland Reservoir. So this was evidence at that point in time that it was quite correct where the water was flowing from the 2 positives originally, and we know now that it is in Merkland Reservoir, the low reservoir. At that site there are 2, there's a tall one and a short one. It was certainly in the tall one, or the short one, I'm sorry. And at that point in time, we immediately isolated that, and we started the procedure to drain that. All throughout this, the discussions we held with Fraser Health and the City of White Rock to update them where we are, receive guidance and suggestions on how we should proceed on that. That proceeded through the night last night. That reservoir was taken down about 8 o'clock last night. We were able to enter that space and do an inspection of it. There was nothing in that space that would indicate there was a potential source of intrusion at this time. You have to recall that if something had gotten in there, the drain pipes are approximately 18 inches, and they're like big pipes like this. Anything that would happen in there would basically have been flushed out into the sanitary sewer. But there was nothing in there that would indicate that we had a problem. Subsequent to that, we actually then went in and cleaned that reservoir. We pressure washed all of the inside, and all the material was taken down from there. At that time, we inspected again to see if something had been overlooked, and nothing was found again inside that reservoir. At that point in time, it was disinfected, and it was allowed to stand for that period, and then the filling procedure started again. That filling procedure now is underway. It will take until approximately 7 p.m. this evening until that reservoir is full. It's about 6 to 7% right now. And at that point in time, that reservoir will be put back online, and then reservoir number 1 will be taken out of service. The logic for this is that, once again, you start with source to tap. You want to start with your clean water and move that out into your system. So we know that the wells, all indications to date, that the wells are all negative. There's nothing in the wells. The aquifer is good, and that's not the problem. The well where this is coming from is like 3 meters away from this storage tank, Merkland Low Reservoir. So we're starting from there. We'll get that cleaned, and then we'll proceed outwards from there to actually clean the system. Our process right now that we've got is that we're going to clean reservoir number 1. It will take approximately 15 hours to drain it, 6 hours to clean it and disinfect it, and another 15 hours to fill it. Then we will move on to the Roper Reservoir. The principle here is one of abundance of caution, is that we want to make sure that everything is clean going out from the source to the tap. So we will be taking down the Roper Reservoir as well and disinfecting it and cleaning it. Following that, we'll start actually concurrently with that, and that's one discussions from a technical perspective on how we're going to do that. If we have this reservoir is clean, can we start flushing the system and moving out now? That is being underway, undertaken right now from an engineering perspective, and then we'll be running that over with Fraser Health to discuss the feasibility of doing that at this time after we take those other reservoirs out of service. And that would probably take another anywhere from 12 to 18 hours, depending on the hydraulic model that we've got being studied right now. So that's kind of where we are with respect to the sequence of events and where we're actually going at this point in time. Some of the key next steps are, of course, is to continue the sampling program throughout the system. We have identified it at that reservoir, but we want to ensure that it's nowhere else. So we will continue to sample throughout the entire system to confirm that it is safe. I think everyone at this table here and all of our staff, we do not want to send water out to our customers, even with the low counts that we found, if there's any possibility that people could get sick at this point. And that's all I have for you.
Just wondered, we had thought that Friday might be the day that you optimistically might be able to lift for a water advisory. Are you thinking it's likely going to be extended?
That's a good question. I think when you go into these things, and if you go back to our original communications on that, it was a week. is what was being discussed at that point in time. There's a lot of uncertainty here. For example, we did not find